السلام عليكم ورحمة الله وبركاته. بسم الله والصلاة والسلام على رسول الله. أهلا وسهلا بحضراتكم. Welcome to the ISB live show called The Community Voice, which is your voice. Right now, this program being launched last year during the quarantine, during the incidence of the COVID, the beginning of the COVID. And since then, we passed through a long journey together. And right now, we reached a phase, a destination where vaccination started. With all the debates being going around, so we're trying hard during those episodes to clear the myth and elevate the fog around the vaccine scientifically. And with that being said, I would like to welcome our guest today, who is Dr. Mohammed Asmal, a very, I would say, a reputable community member. Dr. Mohammed is an infectious disease. He's a trained physician, previously affiliated with the Brigham and Women's in Massachusetts MD, has devoted much of his life to the study of viral infections, the immune system, and the HIV-1 vaccine. Most recently, he had led the clinical trials for the development of treatments of cancer, influenza, and rare blood disease in the biopharmaceutical industry. He has also been actively involved in finding treatment for COVID-19. He has no affiliation with any company working on COVID-19 vaccine. Mohammed, assalamu alaikum. Thanks for being with us tonight.
Shukran. Wa alaikum salam, brother.
So, Dr. Mohammed, we were discussing prior going live today the title, the importance of minorities taking vaccine. So this would be like, we'll be dancing around this a little bit, but before jumping into that, I would like to know scientifically, what are the potential benefits and risks from the COVID vaccine?
Yes, I think it's it's an unprecedented time that we are in right now, where I think the community as a whole is asked to look at and try to understand complex scientific data because of a pressing crisis. And inshallah, I will try to walk the community through this in terms that I hope will be understandable, because I think in assessing who should take the vaccine and whether a vaccine is appropriate for oneself, one needs to be able to digest the information before you and make the appropriate assessment of what is the potential benefit of the vaccine and the risks associated with that vaccine. So to help me walk through some of the data, I think I'm going to put up a very exemplary figure. And this will be the only scientific data I'll show. But if you could put up a figure for me, Brother Zachariah.
Zachariah, can we?
Thank you very much. So first, let me explain a little bit about what this is. So this is data from a clinical trial of one of the two vaccines that is currently being offered in Massachusetts. So as you know, there are two vaccines that are currently being offered in Massachusetts. There's the Moderna vaccine and the Pfizer vaccine. And for the sake of simplicity, I'm going to focus on those two because for the foreseeable future, it looks like those will be the ones that are going to be offered here in Massachusetts and the ones that are relevant to the populations of individuals out there. So what you're looking at is a graph of the effectiveness of the Pfizer vaccine. And sorry, this is, the Pfizer vaccine. And I have to say that the Moderna vaccine looks identical to this. So in this trial, 15,000 individuals got one dose of the Pfizer vaccine, and 15,000 other individuals got the placebo. And so that's not active. And then this graph looks at over time, over days, how many people got infected. The blue line shows the people who got the vaccine, and the red line shows the people who got the placebo. And each of the squares or circles represents an individual infection. And what you're seeing is in this relatively short frame of time, how very different the rates of infection are in individuals that got the vaccine versus those that did not. And I think this is extremely important to to understand, because in trying to assess whether the vaccine is appropriate, it's necessary to understand both what the potential benefit is and the potential risk. So it's the combination of both. And to understand the benefit, one has to look at this, where 95% of potential infections, of symptomatic infections with COVID, were prevented by receiving the vaccine. So uh, out of 20 people who were exposed, infection was prevented in 19 of those that otherwise would have gotten infected. So to put that in a more you know, pressing context, if you think about it, the number of individuals who succumbed to COVID in this country is currently at close to 500,000. That is almost, actually, that's more than 1 out of every 1,000 individuals in this country. So there are about 300 million people in the U.S. and 500,000 deaths. So that's more than 1 out of every 1,000 people. In this particular trial, in fact, one person died of COVID, and that was a person who did not get the actual vaccine. They got the placebo. In addition, 30 individuals got hospitalized for COVID. All of those individuals got the placebo and not the vaccine. So what that means is this vaccine is extremely effective in preventing hospitalization and even potential death from a virus that has taken a very heavy toll on the population. Right? So that's the benefit. It's this very substantial benefit. What do you put against that? So the risks, everyone knows or probably have heard of this at this point, the side effects that most people have. And this can be, pain the next day at the site of the injection, fever, muscle aches, fatigue. All of these are actually signs that the vaccine is causing an immune response, which is what you want the vaccine to do, to build an immunity to the virus. All of these are transient. They usually go away within a day or two. So they don't last as long as the symptoms of a coronavirus infection. And importantly, none of these side effects have yet been attributed to a death. At this point, approximately 30 million individuals have gotten at least one dose of a coronavirus vaccine in the United States. So it's a lot of math here, but I think this is very important to think about. Out of 30 million individuals who've gotten the coronavirus vaccine, none have died. Out of 30 million people who would have been exposed to COVID or would have gotten COVID, if 30 million people had gotten COVID, you would have expected about 30,000 of them, 1 out of 1,000, to have died of COVID, right? So that's one way to think about the risk versus benefit of the vaccine, right? 30 million people given the vaccine, none of whom are known to have died of the vaccine. If 30 million people have been affected with COVID, at least about 30,000 of those would have died of COVID, right? So it's a pretty substantial benefit. Now, that's not to say there aren't rare side effects that are more serious than what I described. So some individuals have gotten very severe allergic reactions, and those do require medical treatment. Fortunately, the treatments have been effective and preventing those allergic reactions. Now, allergic reactions can happen with any kind of drug the first time that they're given, not just this vaccine, and any kind of vaccine. So this is not something unique to the vaccine. And we don't know. We don't know if there will be, in fact, long-term consequences to this vaccine. That is truly unknown. And it is, as I said, an unprecedented time during which this vaccine was developed in a very rapid time frame, right? So we don't know what the long-term effects of this vaccine are. However, I think you'll have to balance that uncertainty against what I just described as the well-defined threat that COVID infection poses to human health, the fact that COVID kills a large number of the people it infects, and that these vaccines are extremely effective at preventing infection and death from COVID. So
Thank you, Dr. Muhammad.
it's
Very,
a lot
very
of information,
elaborative scientific.
um, but that's how I like to think about the risk benefit of taking a vaccine.
Awesome. I have like two questions. I know that the vaccine is two doses. So can one get infected with the COVID in the period between the first dose and the second dose?
Yeah, so different vaccines have different data. So some vaccines, it looks like the protection starts very early, sometimes within a week of the vaccine. And other vaccines, the protection takes longer to show up. So, the safe assumption is to assume that until approximately 2 weeks after the second vaccine, you may not have the full protection of the vaccine. You will have partial protection of the vaccine, but not the full protection until about 2 weeks after the second dose.
Is the COVID-19 vaccine gonna be like the flu shot? Is it going to be annual or like it's a long term, 3 years, 5 years?
That's an exceptional question. I don't think scientists know yet for certain. Um, it's possible this may need to be annually updated. We've already seen the coronavirus mutate several times, and we do know that people who've gotten coronavirus the first time around are not immune to the new versions of corona. So the new versions of corona coming out of South Africa, for example, can infect people again who had the old version of corona. Vaccines do seem to be more protective against the new versions of corona than actually prior infection. So the vaccines are actually more protective than being infected previously. So that's a good sign. However, it still may mean that if the virus mutates more, we may need to get an annual dose.
Awesome. So what you're saying that the vaccine available right now, we name it like Pfizer, Moderna, will protect our bodies from the new strains or the new mutant versions of the virus?
So the early data suggests that there will be some level of protection, and it may be substantial. It probably is not as good at protecting you against the newer strains as it is against the old strain, but it's probably likely to be still fairly protective.
So if it's like right now, the vaccines will protect our lives and it will prevent the COVID-19, which might lead to death. So, from your observation and practice, why do you think people are reluctant to take the vaccine?
So I think that there are many reasons, and I touched upon one of them, which is, and I hopefully trying to allay that fear, which is the uncertainty of the long-term effects. Normally, vaccines take 3 to 5 years to develop because you want to follow patients over a very long period of time. These vaccines were done in a third of that time or less than a third of that time. So we don't have that long-term data. And people are rightfully concerned there may be long-term effects. However, I think one has to then balance that against the very clear benefit that these vaccines have in preventing a disease that has a very high mortality rate and causes a large number of individuals to be hospitalized. I think
So,
other reasons also have to deal with disinformation. So I think, unfortunately, there have been sort of disinformation campaigns around vaccines in general that have, promulgated false information about other vaccines, such as the measles vaccine, et cetera. And unfortunately, those disinformation campaigns have bled through to impact even the COVID vaccine efforts.
yeah, that's right. So, as for the misinformation, where can I would say, the not very tech savvy people, who do not, the elder population, who do not go into the internet frequently, how can we get information about the vaccine? 65,
That's
70
right.
years old.
So I think, firstly, I hope that the ISPCC will help providing links to important information sites. The United States Centers for Disease Control has frequent updates to information. The Departments of Public Health in Massachusetts certainly have information that's updated. I think your physician is an excellent source of information. I would advise individuals to be very wary, very careful around social media. We know about the ease with which false information gets disseminated on platforms like Facebook. Um, and so I think I just urge individuals to be very cautious about taking advice or putting much heed in information that they get via Facebook or via uh, unverified sources.
Thank you, Doctor. So let's shift gears right now and talk more about the community and the minorities and why some people are more, I would say, uh, first to take the vaccine while others are in the back. And from your observation, what about like our community? Do you see them like jumping in the first row and taking the vaccine, our elder community, or are they on the skeptical side?
Yeah, so you know, I think part of the reason why in fact I'm here today is I had the privilege of volunteering at a um, vaccine site here at the Reggie Lewis Arena, right across from the ISPCC. Um, and on the day that I was there, despite the vaccine center being in the center of a community of color, I was disappointed to see that the majority of individuals who were getting vaccinated were not people of color. Um, and my observation was my individual observation was actually verified by other people, and there have been publications on this since, and certainly other people have made the same observation. And um, it's been noted that the urgency with which individuals of color have gone to register for the vaccine has been much less than for other communities. And I think this is a particular concern because we know from the data that is out there that uh, that individuals of color, and by those in particular our African American brothers and sisters, and our Latino brothers and sisters, and our Native American brothers and sisters, are at significantly higher rates of complications from COVID. So this again is on the website for the Centers for Disease Control, but the rates of hospitalization in these populations are about 3 times higher. So if an individual who is Black or Latino or Latina gets COVID, they are 3 times as likely to be hospitalized as a Caucasian individual. And they're about twice as likely to die of the disease. So I think this is a reason why it's especially pressing for individuals of color to get vaccinated. We also know that from an economic and educational perspective, while COVID has been devastating, across multiple communities, it has been particularly devastating to communities of color, where access to remote education may not be as easy, and so the loss of in-person schooling has been especially problematic. I think uh, businesses in minority communities have been hit very hard by closures due to COVID. And we know that people of color disproportionately are frontline workers in restaurants, grocery stores, et cetera, and thus more exposed to COVID. So for all of these reasons, for health reasons, for economic reasons, for educational reasons, it is especially vital that this vaccine has uptake within communities of color.
So, thank you, doctor. So, for the elder in our community who are not tech savvy, they will not go inside the internet or like subscribe or sign up. How do you get access to the vaccine? Is it through like walk in to Reggie Lewis, or like how do you get access to the vaccine?
So there are toll-free numbers that the Massachusetts government has set up, and I think ISPCC will help disseminate those numbers. I think that's probably the easiest way to do it that doesn't involve actually using the internet. Um, Unfortunately, most of the vaccine sites do not have walk-in at this point. So you have to sign up ahead of time, whether it's by a toll-free number or via the internet.
Mhm.
But I do think that one of the problems with the early phase of the rollout was the excessive reliance on the internet, which I think did hinder the ability of individuals who may not have access to the internet to be able to register, or who may not be savvy with the internet. So I do think that was a problem early on in the rollout. But I think, with the toll-free numbers that are now available, hopefully that will be of help.
And I was discussing with some folks at the IBC, and I know that they are arranging something whereby they will be collecting our elderly from the community, do the sign up, and put them like in van and drive them to the vaccination sites to take the vaccine. And I think this will be very good service from the ISBC as well. Doctor, thank you very
I
much,
think
Muhammad. Yeah, go on.
Sorry, what I said, this is a wonderful opportunity that ISBCC is taking to really help the community here. I think in helping individuals sign up by providing some kind of logistical support and with helping transportation, I think mashallah, that's wonderful for the community in need here.
Awesome. One final thing, you said that there's an announcement, breakthrough announcement for the people above 65 in Massachusetts. Can you please shed some light on that?
Yeah, so as everyone knows, the COVID vaccine is being rolled out in phases. And so phase one involved individuals older than 75 and healthcare workers. And now phase two is officially, it was just announced beginning tomorrow, individuals who are older than 65 now are eligible to get vaccinated, as well as individuals with two or more comorbidities. And by comorbidities, these are chronic health conditions like diabetes, heart disease, asthma. So there's a list of these diseases that are also very prevalent in our population. Which, if you have two of them and you're younger than 65, you will be eligible to get vaccinated. Or even if you have no comorbidities, if you are simply 65 or older, you will be eligible to get vaccinated. I encourage everyone to take advantage of this and sign up as soon as possible.
That's awesome. And I read that those even comorbidity you don't have to prove it. It's like a word of honor. You have the comorbid disease, so you sign for it and you go and take the vaccine. So, Mohammed, thank you very much for being with us tonight. Been very helpful. You shed some light on stuff that people in our community were like skeptical about. I hope after this episode, people will come to the ISBC, sign up, and you will see a big chunk of our community at Reggie Lewis Vaccination Center. Thank you very much and have a good night. Thank you, sir.
Thanks a
Assalamu
lot.
alaikum. Assalamu alaikum.
Bye.